If you can keep your support knee totally happy and have shin on block, do that. Otherwise, please use that pillow instead. One knee up, one knee down on the ground, and first be on the hands and kind of let yourself get leaned off to the side because, you know, the lower body is asymmetrical. But then take the course of a few deep breaths to kind of crawl your upper body to feel like you're centered. And then, morning Susan, and then to look at those thigh bones and adjust the hips. So both thigh bones look vertical, hip over knee. Yeah, and once you got that, then take your time. Be sure you don't kind of fall off to the side as we come down onto our forearms. Yeah, so it will take some breath, and especially because we all have a little bit of rotation in the lumbar spine one way or the other. And so if you started on the side that matches your natural rotation, it might be easy to be centered. If you're doing opposite your natural rotation, this is going to feel weird. You're going to feel like you really want to lean over to the side. So just breathe and let your tissues adapt to this high hip position. Good, good, good. And let the abs really soften and let the belly spill forward onto the thigh bones, really deep hip creases. And feel how all of that, really softening the hip of the lifted leg, all of that is letting that thigh bone get pressed deeper back into the socket. Yeah, and see if you can stay in that sense of deep release and not get contracty as we put our weight on the lifted shin so that we can cross that other one behind. And as we cross behind, feel how the hip on that cross behind side is now really falling forward. Your abdomen is turning toward that lifted thigh, and just breathe here. That can already be a lot. Good. You could overlap your hands to catch your head so your neck doesn't have to be activated this whole time, but do be sure that the ribs aren't falling through, that we have length through the whole spine there. And then you might play with just a little bit of back and forth weight shift. Good, good, good. Notice if there are moments of weight shift where your belly tenses up, where your tailbone starts to want to tuck under. How do we keep all of this feeling of release and hang with all the back and forth? Good, good, good. And then let's get the weight centered so you have your hip stacked right over your knee, and then go ahead and uncross and let that shin come down to the floor for a sec. Now you could stay on the elbows or you could pop back up to the hands if it feels like it would be easier. But now we're going to do the thing where we press the block knee into the block or the pillow to elevate the other knee until the two knees are suspended side by side. And then we're slowly going to hang that shin back down into the ground. And just do that a few more times at your own pace. And same thing, you want to see the thigh bones continue to stay vertical. And so you're just sliding the one up and sliding it back down. And then the next time you press and hover, hold that for 10, breathing, 9, 8, 7, 6, 5, 4, 3. Now let's take 10 seconds to lower it back down. 10, 9, 8, 7, 6, 5, 4. Shin is landing and let it deepen into the ground. Relax completely. And then let's take one more cross behind. So we come back into that, that same deepening. Allow the pelvis to really rotate. Do a little bit of weight shifting. And find your favorite position of release and hang out there and just get a couple of nice deep breaths with that. Fantastic. Okay, so then let's unwind. Let's take the leg that was elevated, slide it back. We have the ball of the foot tucked under, and we can do that little ankle and foot mobilization, shifting back and forth. While you're doing that, just go ahead and nudge your block or your pillow out from under you so the mat is clear. Next time the heel goes back, let's stay and really push through that heel and really lift the back of the knee for a sec. Good. And then gently set that knee down. And go ahead and get your block or your pillow on that second side. Again, let's start on the hands and notice if you feel a little cattywampus. How do we get the hips right over the knees so we see our parallel thigh bones? And only once you've found that do we want to lower ourselves down onto the elbows, possibly stack the arms to rest your head. And then again, let's just breathe and let all the soft tissue adapt to this funky position of the bones. So we'll feel the thigh bone getting pressed deeper back into the hip socket. We'll feel that other shin maybe getting a little heavier into the ground. It might feel light at first because we're kind of hung up on the other side. So yeah, feel one pelvis pressed way up to the ceiling, the other pelvis dropping into the ground. A couple more breaths there. Lovely. Okay, and when you feel ready, try to keep all that sense of release in the elevated hip as we put weight on it to cross that other one behind. Good. Allow the pelvis to turn. Yeah, the one side of the pelvis is hanging, belly is turning toward that support lifted thigh. Yeah, and then here's our little weight shift, back and forth, back and forth. Good, yeah, and this is progressive, right? Each step we take is adding intensity, so you can always take a step back if we get to too much intensity. Again, really be on the lookout for the tailbone curling and some roundedness coming into the low back. So everybody shift forward for a sec. And actually go ahead and relax your abdominals and really let your belly hang. More. Imagine you're going to let your belly fall on. Yeah, there you go, Lorene. Let your belly fall on that support thigh. Now keep that release of the belly and maybe slide back. Tailbone in the air, tailbone in the air, tailbone in there. Yeah, there it is. Amazing. And that's our deepest release for the hip. Otherwise, it's the glutes kind of pulling us into a tuck. Awesome. Okay, so when you're ready, let's uncross and set that shin back down on the ground. Double check that you've got your verticals, elbows or palms, your choice. All right, let's press into that elevated shin so the other one hovers and they're side by side. Take your time to lower back down. Remember, on the ground shin, that toe can hang out on the mat the whole time. You don't have to pick your foot up. You could, but if the foot's staying on the floor, just be sure it's not pushing. We don't want it to come from the push of the lower leg. So push of that elevated leg to suspend the other side. Yeah, that's the core work. Good, a couple more times. The thigh bones are just sliding along their vertical pathways. Good. Okay, next time we're gonna hold it for 10 seconds. 9, 8, 7, 6, 5, 4, 3. Can we take 10 to lower? Here we go. 10. So slowly. 9, 8, 7, 6, 5, 4, 3. Heavy shin, really deepening, full release of that weight into the ground. Pelvis is fully rotated again. And then take one more cross behind if you like. A little weight shift. Find your favorite place. And hang and breathe. Yeah, just keep thinking. Soft belly, tailbone pitched way up in the air. Yes, good. That is it. Beautiful lines. Okay, when that feels complete, we can uncross again, set that shin down, elevated leg gets to lengthen back. Take your push-pull, get your block or your pillow out of the way. And part of this, we've had weight on the knee for a little while. So we want to get the knee really straight, lift the back of the knee up to the ceiling, get those kneecap muscles engaged, just like reanimate. Yeah, and then keep the heel pressing back and back and back, breathing. Long stretch through that calf. Let's go ahead and flip over and have your TheraBand handy. Then let's take the band around 1 foot. We want to get the foot right over the hip socket. So if you can do that with a straight leg, cool. If you need a little bit of bend, totally fine. And then just a little bit of activation in kneecap muscles to stabilize however straight that is. Now let's use the band to pull straight down and have a sense that we're just pulling that thigh bone deeper into the socket. So, we already warmed that up on our shins to really get the thigh bone in there. The other leg could stay bent, it could drop out straight, whatever facilitates really pulling this leg into the socket. Breathing as we let that deepen further. Feel how the more we pull the leg into the socket, the wider contact we're probably feeling of this side of the pelvis into the mat. So feel that too. Feel how it's that side of the sacrum and then even a little to the outside of that, some of the glute tissues really getting pulled into the floor. The big challenge is keep the leg in the socket. Keep all that pressure on that hip. What little bit can we cross the leg over? It's really not going to be much if we don't roll off this hip. And then just slowly come back up to vertical. Yeah, and even as the foot comes across toward midline, keep using the band in a very specific way of really pulling the leg back into the hip socket. Yeah, and then back to your hip alignment. So both the anchoring of that side of the pelvis and the keeping the leg really deep in the socket, both of those things are going to prevent a lot of movement across. A couple more times, just seeing what's available. And here too, we can have a really soft belly. Abs don't really need to be doing much other than helping us move the breath. Next time you come across, let's stay a little bit extra. And again, just really use that pull of the band. You might feel like you're doing a really strong rowing exercise, right? To get the leg into the hip and get that pelvis into the ground while the leg is hanging across. One more full breath in and out. And then come right back over the hip and take an easy breath there. You can stop all that pulling for a sec. Relax your grippers. Now let's keep the leg stacked up where it is. And now let's just move the ankle. So let's turn the, from having the foot kind of flat toward the ceiling, can we angle the bottom of the foot to face across your body and then shine it back up toward the ceiling? And again, shine that panel over, so it's a little side bend of the ankle, and shine it back up toward the ceiling. A couple more times. Collapsing over. And neutral. Crossover, hold. Okay, so keeping the bottom of the foot facing across the body. Resume that downward pull on the band. Deepen the thigh bone into the socket. Deepen the pelvis into the ground. Now that might already be a lot, but if it's available, maybe the leg leans across again, but keeping that bend in the ankle. Lots of breath, not too intense, 5 out of 10 max. Keep the ankle active in its bend. Keep trying to deepen in the leg. Really sit that side of the pelvis back into the ground. A couple more breaths there. And then relax the ankle out of its shape. Then the leg can come up. Let's go ahead and step out of there. Both knees bent, both feet flat. And then just give the knees a little bit of a sway so that we're, rocking and rolling across the full width of the pelvis. So we get to feel a little bit more of it, more of it. Yeah, and then settle back into the middle, find center. Great, okay, and then go ahead and take the band around the other foot. Same thing, we want the foot right over the hip. Knee can do whatever it needs to do to achieve that. And then once you found that vertical stack, we can start rowing with the arms to pull that leg bone into the socket. And then pull that pelvis into the ground. Other leg can do whatever it wants to do. Now, if we're successful at really getting this thigh bone into the hip socket, we should feel like all of the muscles of this hip, especially the hip flexor, completely relaxed. So that hip flexor is not having to work to hold the leg up. That leg is clicked like a Lego block into its joint. It's not going anywhere. A couple more breaths to just allow the hip socket to receive the thigh bone more deeply, to feel that whole other side of the pelvis now having all of its contact and anchor into the ground. And let the foot and the ankle just stay relaxed and neutral, and let's barely cross this leg over what's available, and then come right back to your stack. Yeah, so as we cross the leg over, if anything, we're pulling that thigh bone deeper back into its joint. We're sitting that side of the pelvis even more heavily back the other way into the mat. Yeah, just a few more times, across and up. Soft belly, easy breath. Next time we cross over, let's stay a little bit extra. All right, and then right up over the hip socket, go ahead and ease up on your grip for a second. You might give your hands some stretches, stretch. And then keep your easy grip. And now let's do just the ankle movement. So shine the sole of your foot across to the other side of your body, and then aim it right back up at the ceiling. And as we do this several times, practice the isolation of the movement too. So the thigh bone ideally is perfectly still. Your kneecap is perfectly still. Truly just the ankle and the foot in that movement. Yeah. Good. Okay, so now next time you bend that across, let's keep that angle. Resume pulling your leg into the socket, pulling your pelvis into the ground, and just a few times of crossing over and coming back up while we keep the ankle in its bend. Keep the thigh bone in the socket. Keep your anchor into the mat. And on your next one of crossing over, let's just hold and breathe. If it's super intense, you might not totally hold. You might put a little wiggle in the ankle, like out of it a little bit, into it, out of it, into it, just so that we're not in a really intense position without movement. All right, from here, let's allow the ankle to unwind to neutral, then the leg can come up, and then let's step out of there. Awesome. Go ahead and set your band aside for a sec. Both knees can bend, and then maybe, again, just a tiny little knee sway. So we're not even trying to get around to the side of the pelvis, just really feel the entire width of the back of the pelvis. Good.